anticoagulants, the fluid portion of blood is plasma, and when we allow it to clot, what comes out is serum. Hmm? Okay. Here I want to give you an assignment. Don't submit now. I will give you unless there is some doubt. You should not submit this assignment to me. Okay. Hmm? I will give you a specific date for submission of this assignment. The assignment is differentiate between serum and plasma. Differentiate between serum and plasma. Okay. Differentiation should be in the collection method. First point is collection method. Use of anticoagulants. Hmm? And third is composition. Composition. Okay. I should say there is some trick here because collection method is same for both of them. But yes, there is some difference between the collection actually. That's why I asked collection method. What should be the precautions while collecting the blood with anticoagulant or without anticoagulant for plasma separation or for serum separation? That's why I asked collection method, use of anticoagulants, and third is important difference in composition. Important difference in composition. These 3 points should be there in the assignments. As much detail you can go, you please go, because this question is very, very common. All your life it will be repeated. So we go ahead with the anticoagulants. First important anticoagulant is EDTA, ethylene diamine tetraacetate. Ethylene diamine tetraacetate. It is also called as Versene, 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 or sometimes sequestrine, Sequestrene, sequestrine, Sequestrene, EDTA or Versene or sequestrine. The mechanism of action is calcium ion chelation. Calcium ion chelation. Chelation is a kind of bonding found in especially in the solution where the chelated ion is rendered chemically inert. It is I should say coordinate bonding in chelation. That is important. It chelates out the calcium ions. The dose rate is 10 to 20 milligram per 10 ml of blood. 10 to 20 milligram per 10 ml of blood. It is very good for 6 hours preservation. It is very good for 6 hour preservation. Up to 6 hours, it is very good anticoagulant. It is most commonly used anticoagulant. There are two anticoagulants which are very commonly used. One is EDTA, one is heparin. Next we will discuss. So EDTA is one of the most commonly used anticoagulant. However, higher dose can lead to osmotic shrinkage of RBC. Higher dose can lead to osmotic shrinkage of RBC. So RBC appear crenated, CRENATED, crenated. Okay, next anticoagulant is heparin. Heparin, another one of the most common anticoagulant. The mechanism of action is antithrombin and antithromboplastin. It will interfere with the thrombin and thromboplastin. Antithrombin and antithromboplastin is the mechanism of action of heparin. Dose is 1 to 2 milligram per 10 ml. 1 to 2 milligram per 10 ml. We also use it as 1% solution where it is used 0.2 ml per 10 ml. 0.2 ml per 10 ml. 1% solution, how much? 0.2 ml per 10 ml. These dose rates are very important clinically also and for exam purpose also. Advantage is that it has got minimum effect on the minimum osmotic effect on the cells. It has got minimum osmotic effect on the cells. However, it gives anticoagulation only for 8 hours. Proper anticoagulation only up to 8 hours. After 8 hours, the coagulation may start appearing. This anticoagulant is not very good for agglutination test. Agglutination test. And it may also lead to clumping of WBCs. Clumping of WBCs. They get separated out in the solution. Okay. One of the easier method of blood collection by heparin is we take the heparin solution. I'm saying small amount of blood. Suppose we are not taking 10 ml full. We are taking only 3, 4 ml. What we can do, we can take little bit of anticoagulant into the syringe, heparin solution into the syringe, and push it back into the vial. So walls will be smeared with heparin, and towards the edge of syringe, where the plunger stops, very little amount inside the syringe and in the needle remains. And that much is enough for 1 or 2 ml blood, because it is having minimum activity or osmotic activity, so cells are also preserved. So this is another method of blood collection using heparin. The next anticoagulant is the potassium oxalate. Actually, oxalate is the anticoagulant. Oxalate is the anticoagulant, and it works by calcium precipitation. Potassium salt of oxalate. The dose is 20 milligram per 10 ml. 20 milligram per 10 ml. Advantage is it is very soluble, far more soluble than EDTA. In some animals where there is hemoconcentration, or in some diseases, blood literally tends to coagulate as soon as it comes out of blood vessel. Okay. In such cases, the anticoagulant should be very, very fast. It should immediately dissolve and immediately exert its chemical action on the blood calcium. Okay. So that is why potassium oxalate in some cases can be preferred over EDTA. However, it is still less used. It is very soluble. However, it is not good for PCV and other RBC associated parameters. It is not good for PCV and other RBC associated parameters for major 2 reasons. It is having, if we are using it in a solution form, then it dilutes the plasma. And in another reason is, if dose rate is marginally missed, even little extra dose can lead to strong osmotic action. It is having very strong osmotic action. Potassium oxalate. Then we go to sodium oxalate. It is once again, it is same. Oxalate is the anticoagulant. Sodium salt is used. It is one of the best for prothrombin time. It is one of the best for prothrombin time. Actually, we use 0.5 ml of 0.1 molar solution for exactly 4.5 ml of blood. 0.5 ml of 0.1 molar solution in exactly 4.5 ml of blood. These disadvantages are very similar to the potassium oxalate, that it is having strong osmotic action. So it may lead to dilution of plasma. Even use of extra can cause shrinkage of RBC. Then next is Heller's and Paul's double oxalate. HELLER apostrophe S. HELLER apostrophe S. Heller's and Paul's. PAUL. Paul's, Heller's and Paul's double oxalate. Now this Heller's and Paul's double oxalate means it is having 2 types of oxalate salt. One is ammonium oxalate, NH4 plus dash oxalate. Another one is potassium oxalate, ammonium salt of oxalate and potassium salt of oxalate. There is a preferred ratio of these two. Okay, ammonium oxalate is very hypotonic, so RBC may tend to swell, osmotic entry of water inside the RBC. While potassium oxalate, as we have seen earlier, is having strong exosmosis action. It extracts water from the cells, causes shrinkage of RBC. So if we use them in right combination, right ratio, say 3 is to 1, 2 is to 1, we can have a osmotically neutral anticoagulant where the oxalates are used. So it causes minimum distortion and minimum chance of because if we use ammonium oxalate, a little extra may lead to hypotonic solution and RBC starts swelling and bursting. At the same time, potassium oxalate, if little bit here and there goes, it will lead to shrinkage of RBC. So it is always preferred as Heller's and Paul's double oxalate. Another example is another salt of oxalate used is lithium oxalate. Then lithium citrate is also there. Lithium oxalate, lithium citrate is there. And these lithium salts are used for mineral constituent analysis. Lithium is not normally seen in the biological system, so it does not interfere with the analysis of other minerals. It's a complicated fundamental. It's not scope here to explain all these things. Okay. Please remember, oxalates and citrates, they work by precipitation of calcium ion. Precipitation of calcium ion. Then another very, very important anticoagulant, sodium fluoride. Sodium fluoride. Now, this sodium fluoride is the preferred anticoagulant for the estimation of glucose. Sodium fluoride is preferred anticoagulant for estimation of glucose. Why? Because when we collect the blood for glucose estimation, the blood contains live cells. These live cells continue consuming glucose, and therefore, while the blood is being stored or for plasma separation, for serum separation, or even for any other analysis, just simple storage, the glucose level slowly comes down. So therefore, in a diabetic animal or a hyperglycemic animal, there may be misinterpretation of data. So consequently, we require an anticoagulant which is also inhibitor of glycolytic enzymes. Sodium fluoride is inhibitor of glycolytic enzymes. Do you understand this point? I think. So it is best for glucose estimation. However, at the same time, because it is having enzyme inhibitory activity, it is not good for enzyme estimation in blood. So therefore, if we are not estimating glucose, the sodium fluoride is generally of no use. But for glucose estimation, it is the best. It is used with thymol in 10:1 ratio. 10 parts sodium fluoride and 1 part thymol. This sodium fluoride, the fluoride actually forms a weakly dissociating complex with calcium. Weakly dissociating complex with calcium. So calcium generally remains outside the solution. It literally precipitates out. So therefore, the clotting cascade is broken. We use around 100 milligram of chloride and 10 milligram of thymol per 10 ml of blood. 100 milligram of fluoride and 10 milligram of thymol per 10 ml of blood. Thymol is used as antibacterial agent, antimicrobial agent, because the blood collection cannot be completely aseptic. You may inhibit the enzymes of cells. However, after some time, bacterial growth may start taking place and they will consume out the glucose. Or if the parasites are present, they will consume out the glucose and consequently lead to the loss of the concentration. Therefore, there is use of sodium fluoride in combination with thymol. Okay. Then ACD solution B. ACD solution B. And it's not ABCD. ACD solution B. ACD stands for acid citrate dextrose. ACD stands for acid citrate dextrose. ACD solution B. This is the classical anticoagulant solution for blood transfusion. Blood transfusion, it is having buffering these chemicals like acid citrate is there, and dextrose is actually glucose. Dextrose is the easily utilizable, I should say, the isomer of glucose. Okay, it is actually optical isomer of glucose, dextrorotatory glucose. It is easily absorbed and utilized, and because glucose is present in this, it never allows the death of cells due to lack of energy. So it is used for blood transfusion. 25 ml of ACD solution B per 100 ml of blood. 25 ml of ACD per 100 ml of blood. Okay. In that serum and plasma, some points I would like to discuss. That like serum is without anticoagulant. Plasma is collected with anticoagulant. Now serum is preferred for those analyses where the presence of anticoagulant can interfere with the estimations. For example, enzyme estimation. Anticoagulants not only target calcium, but they also target other heavy metals. And therefore, many enzymes can get inhibited. So, especially for enzyme estimations, the plasma is not preferred, instead, serum is preferred. However, those enzymes which are inside the blood cells and while coagulation they come out, for such estimations, serum is not preferred, plasma is preferred. Okay, because serum will have invariably higher concentration of such enzyme like alkaline phosphatase in the RBC. The serum will have invariably, while clotting, while squeezing, some RBC get lysed. So serum will always have some amount of hemoglobin in it. So we said hemolyzed serum. And if the collection method is weak, serum can literally turn all red. And that is why in such cases the estimation is interfered, because most analyses are based on spectrophotometric or colorimetric analysis. You might have seen in biochemistry, and therefore it is lost. There is interference in that. Okay. before collection of blood, uh, the animal should be preferably fasted overnight or for few hours at least, because if animal is fed with, uh, it happens actually, the diet of animal may contain high fat, and it may lead to lipemic blood or lipemic plasma, lipemia, presence of excess fat, है ना? Lipemic plasma, and this interferes with the estimation. And such plasma or such blood on standing may get on surface the cream layer also. Hmm? The one class I will take about the blood smear later on. Yes, safe limit of blood collection in any species. Suppose there is a wild species. For human being, around 400, 500 ml, 300 ml is very safe. Hmm? So 400, 500 ml, you can take out blood from a normal male, human male. Like dogs, it is 100, 200 ml, depending on size. Hmm? But there are some wild species. You are never sure collection of even 10 ml of blood is safe or not. So there is a thumb rule, and that thumb rule is 0.5 ml per kg body weight is the safe limit of blood collection. 0.5 ml per kg body weight. So if you have a 10 kg animal, wild animal, so up to 10 ml, up to 5 ml is of no danger. Up to 5 ml blood you can easily collect from such animal. Okay, for 20 kg animal, 10 ml. Say for 1 kg small animal, half ml of blood is enough. That is very safe. Of course, there may be higher limits. By experience, you will learn, but this is safe limit I am talking about. Okay, so we conclude these two topics of blood collection and the the uh, the site of blood collection and the anticoagulants. Uh, any doubt, anybody? Anything you want to discuss or ask? Yes, please.
Excuse me, sir.
Yes.
Sir, what is the other name for EDTA? That word something.
Vercine,
Yes, sir.
Versene, Vercine.
Okay, sir.
And sequestrines, sequestrene, sequestrine,
Okay, sir.
Vercine and sequestrine.
Sir, sir,
Yes.
for sodium salt, what was the composition?
Sodium salt of what? Sodium
Oxalate.
oxalate or
Yes, sir.
sodium fluoride? Which one?
No, sir. Oxalate.
Sodium oxalate. It is one of the best for prothrombin time, and the use is 0.5 ml of zero point 0.1 molar solution in exactly 4.5 ml of blood. That was the usage. Nobody is going to ask you this much, but please remember, practically it is very useful. Yes.
Sir, could you please
Hmm.
explain once again about sodium fluoride?
Okay, sodium fluoride is a preferred anticoagulant for the glucose estimation, and the major reason is sodium fluoride is enzyme inhibitor. It inhibits the glycolytic enzymes. In the plasma does not have any glycolytic enzyme. In these cells, especially the RBCs also utilize glucose apart from WBCs. So when these enzymes are inhibited, excuse me, When these enzymes are inhibited, what happens is that there is no utilization of glucose by these cells while storing. Otherwise, as such, even with say EDT anticoagulated blood, heparin anticoagulated blood, what will happen? These cells will consume out the glucose. So even if the animal is having hyperglycemia, the ultimate result will come within the normal range or even lower than that. And then the misinterpretation of the clinical diagnosis takes place. Therefore, we require such kind of anticoagulant which will stop glucose utilization. So sodium fluoride is this. Then another point is, if not the cells, then the bacterial growth in the blood, collected blood, this can lead to utilization of the glucose, bacterial growth, or even the parasite hemoprotozoa, if present, they can utilize the glucose. So we add thymol. Ratio is 10 is to 1, 10 part sodium fluoride, 1 part thymol. Okay, and like for example, 10 mg sodium fluoride, 100 mg sodium fluoride and 10 mg thymol per 10 ml of blood. This is the usage. So thymol will not allow the growth of bacteria, and sodium fluoride will kill all the enzymes, especially the glycolytic enzymes. Therefore, the glucose content of the collected blood will not change and the interpretation becomes exact. The disadvantage is same because it inhibits the enzyme. Therefore, enzyme estimations in sodium fluoride collected blood is of no use because enzymes may not show activity. Okay. Any more explanation? Any other doubt?
Thank you.
ACD,
Yes.
the ACD solution.
ACD, D for dog. Acid citrate dextrose.
Oh,
Solution B. Acid citrate dextrose. Solution B. Dextrose is the dextrorotatory glucose, the most utilized glucose derivative. Hmm?
so,
Okay. This is blood transfusion, 25 ml per 100 ml of blood. Those of you who will practice the dog, the blood transfusion in dog, they will later on understand what I want to say by this. Huh? Anyone else? Anything? Please.
Sir, for uh,
Yes, yes.
sir, for heparin, what was the last point that another method of using heparin is some?
That was practical method of using heparin. We take the heparin liquid vial, we fill the full syringe with heparin. We'll full syringe. Say 10 ml syringe is there. All 10 ml syringe will take 10 ml heparin in that. Okay. And then we will push the heparin back into the vial. Okay. Through the syringe, we will push it back. Now what has happened? The walls of the syringe have the heparin sticking over that, and the end of the syringe and the needle, it is having little amount of heparin in it. So now the it is done especially with the 10 mg per ml solution. 10 mg per ml solution. Now this syringe is having enough heparin for blood collection. This is a crude but very fast, effective method of blood collection. Okay. Could you understand?
Yes, sir. Thank you, sir.
Yes.
Sir, for enzyme estimation, we use, you said we use serum. Can you explain that once again?
The point is, for different enzymes, different sample is preferred. Okay. Like for alkaline phosphatase, which is present in RBC, if we allow the blood to clot and serum to come out, RBC meanwhile contributes lot of alkaline phosphatase into the serum, and therefore it is not preferred. While in collection of plasma, we use anticoagulant, say EDTA. Heparin is one of the good anticoagulant, but like we are using EDTA, we are using oxalate. These anticoagulants actually tend to inhibit most enzymes. So plasma is generally not preferred for most enzymes, while serum is not preferred for those enzymes which are present in RBC and WBCs, because that's how their estimation becomes higher. If we want enzyme estimation, then the preferred anticoagulant is heparin, not for all enzymes, but most enzymes. Some cholinesterases, some lactic dehydrogenase, isocitric dehydrogenase. These enzymes are inhibited by heparin also. Okay. And for such cases, it is better to take plasma, so the serum. Okay. Hmm? Would you understand? Now it's a little bit high level topic, na? Not very high, but yes, at your level, it may not be that easy to understand.
Thank you, sir.